Okay, I'm live.
In this segment, we're going to start our discussion about the shoulder girdle. So the shoulder girdle includes the clavicle and the scapula and the upper portion of the humerus. Each of these contribute to the framework supporting the mechanism of the shoulder. When we're looking at the structural assessment, we're going to compare the size of the humeral head in the x-axis and z-axis. We can also look at the length of the clavicle, and so make sure to find the medial border of the scapula and position your thumb or fingers over that. And then to locate the distal point of the clavicle here, just find the outer portion of the acromion process and feel for a little bump here, which is the upper portion of the lateral epicondyle of the clavicle. And you want to compare the length on both sides, like so. You can use your calipers for that as well. Also, you may find on the same side of enlargement in the long axis, you'll see a thickening or widening of the clavicle in the y-axis as well. Okay? And often tender or distorted, you may actually see that the clavicle extends forward on that side as well in order to accommodate the expanded S shape. You may also find an expansion of the coracoid process just on the medial portion, just medial to the humeral head here. And then you want to look at the scapula. So your landmarks for testing the size and shape of the scapula are the posterior tubercle of the acromion process and the medial portion of the spine of the scapula just below the superior angle here. So follow that to its extremity here. Look at that and compare both sides. And you're comparing the size, the width in the x-axis. To determine the y-axis, you can look at the medial border here and get a landmark on the medial portion of the spine of the scapula and locate the tip of the scapula here. You may need to ask the patient. To rotate their arm back into internal rotation in order to access the inferior angle. Okay, and you're going to compare both sides in terms of length. In the normal circumstance, if the scapula is enlarged, it depends on how the injury occurred. A direct injury through the humerus will transmit into the scapula, and you'll see an equal expansion in the y-axis and the x-axis. But we also want to consider that you may see just an expansion in the y-axis along the medial border, but not a corresponding expansion in the x-axis. This may indicate a direct blow to the posterior thoracic area, which may indicate a posterior depression affecting the upper thoracic area and rib cage, in which case you may see a corresponding hypokyphosis as well as a depression of the rib cage posteriorly. All right, so based on those considerations, you're going to make a determination which of those areas may need to be treated first. Consider the hierarchy with regard to this area. The shoulder girdle is a structure that should be addressed at a certain point in the hierarchy, normally after you've done your other higher order primaries, which includes the lower extremity and the neurological factors, things like the cranium, dental, and spinal areas that are feeding into it, and even the rib cage depressions or expansions underlying this may factor into that influence. So then the shoulder girdle fits in as the next step in most cases in order to complete that treatment. Otherwise, you may wind up not getting a thorough release, and you may have to come back to it, so it's a little less efficient. So remember to always consider the hierarchy when treating any structure. Okay, so let's have a look at how we approach it in the case of our model here. So we're going to make sure they're positioned Always, when you're positioning your patient, make sure they're comfortably positioned towards the back of the table. So I'm going to get you to bring your hips back towards me. Keep going. And guide them back. Place your hand back here so you're never having to reach or strain to locate an area. Okay? So we're going to look at this area. We've already assessed it structurally. And our scan may also have indicated that this is an area that we're going to be treating. And we've treated the appropriate areas in relation to it. One other hierarchical structure, if the injury came in through the humerus, either through the forearm or the upper arm or through the shoulder directly, remember that the long bones of the upper extremity take precedence over the shoulder girdle in terms of the electrical conduction. So those should be treated first. So once we arrive here at the scapula, we can target that area, and then we can find our landmarks. So looking at the x-axis, we're going to be testing the x-axis through the humeral head in that direction towards the medial border at the spine of the scapula. That's test number 1. Test number 2 will be in the y-axis, like so. And there may be a third test which will show up on the lateral border in this vector along here. So there are three separate areas, and there also may be a portion right in the spine of the scapula which is tested inferiorly, essentially towards the feet, okay, coming along here. And that's the posterior border of the fossa, of the supraspinatus fossa. Another point here is the actual configuration or the structure between the superior medial border and the scapula. This represents expansion or injury to the actual supraspinatus fossa. And lastly, the acromion itself, and possibly the glenoid process going from posterior to anterior towards the coracoid process. Right? For now, we're going to focus just on the larger blade portion of the scapula for our treatment. Okay? So in the case of the x-axis being a primary, we can use our scanner in position here, like so. We want to contain laterally right through the lateral aspect of the humeral head, and our containment is going to go towards the medial border. Our other point here is going to be contained on the medial border near the spine of the scapula, and we're going to contain towards the center of the scapula in the x-axis. And there may be certain points, and you can use an indicator on the shoulder to determine exactly where you need to contain that, and you may require 1 or 2 containments to release that completely in the x-axis. The y-axis containment on the medial border is tested like so, and then we're going to be containing from the superior aspect of the spine of the scapula, and the containment is down roughly towards the feet. Inferiorly, try to contain as much of that superior border of the spine of the scapula as possible, and containing down towards the inferior. Locate the inferior angle, bring the arm back if necessary to find where that is, and you can feel the movement there. It's going to be a very small contact point which can really only be accessed comfortably through the pisiform area. So locking in on that right in here, and then positioning yourself comfortably, and in this case I'm going to adjust the table height to help me out. If you don't have an adjustable table, then you want to position your legs so that you can keep a good upright posture, always positioning yourself comfortably no matter which area you're treating. And so my containment with my upper hand is inferior, my lower hand is containing superiorly. So those are the 2 main vectors to take care of this lower portion of the scapula, including the spine of the scapula.